President Biden's among the millions of Americans who've tested positive for COVID recently. The difference is he may have the best homework setup ever. Others are not as fortunate. For many, a COVID case means you can't work at all, can't get paid. Or if your kid gets it, now that they're out of school, you've got to figure out childcare. Millions lived through that disruption during Omicron last winter. The question is whether we're on track for that again in the fall, and whether Americans, by and large, have accepted that as reality. Here's where we stand. Right now, we're averaging more than 127,000 cases a day, just a fraction of the number of cases reported during the Omicron surge last winter. Johns Hopkins reports infections are still up about 31% over the past month. Now, health experts admit the real number of daily cases is likely much higher than that, because many of us, most of us maybe, use rapid tests at home, and most people don't report those at-home results. But keep in mind, hospitalizations are an important and telling metric. They show how many people are getting seriously ill from COVID. And as you'll see here, hospitalizations are increasing, though gradually. No major spike. But HHS data does show they're up almost 50% over the past month. One of the main factors, doctors tell us, is the coronavirus Omicron subvariant called BA.5. CDC reports it now accounts for about 4 out of 5 cases reported nationwide. Health officials say the variant is much better at evading immunity from both vaccines and previous infections. Dr. Paul Offit's with us now, director of the Vaccine Education Center at Children's Hospital in Philly, also a member of the committee that advises the FDA on vaccines. Doctor, thanks so much. Set the expectations for us, if you would. What's life with COVID look like now and in the months ahead?
So what we're seeing with Omicron and the Omicron subvariants are these immune-evasive, highly contagious strains. I mean, when you see people like Dr. Anthony Fauci or President Biden, who are very careful and are highly vaccinated and mask whenever they can, getting that infection, it tells you how hard it is to avoid being infected. I think if you want to completely avoid being infected, you should never leave your house. Yeah. I mean, we're living in an age now, fortunately, where you probably have about 80+% population immunity, meaning people who've been naturally infected or vaccinated or both. And that's why you see, when you see these sort of dramatic increase in cases, and you're right that the case numbers are probably much greater than what we're describing, there is a bump in hospitalizations, but not a dramatic bump, and a bump in deaths, but not a dramatic bump, because for the most part, vaccination and natural infection have protected us against serious illness.
You know, there's talk, speaking of vaccinations, of healthy people under 50 getting a second booster. Is that necessary?
I think the focus really should be, with this now, the 4th dose, or for those high-risk groups, meaning people who are elderly, and especially the elderly, meaning people over 70. I think people who are immune compromised because they're getting agents, to treat their cancer or something of that nature. And then people who have the kind of health problems like serious lung disease, serious heart disease that put them at high risk of COVID. I think that should be the focus, because that's really those are the people who are most likely to get hospitalized and most likely to die. We should focus on them rather than trying to blanket the country, because I think a lot of the country is turned off to these boosters.
Yep, indeed they are. Dr. Offit, it's great to see you as always.